Now, with the closure of certain publications and the threat of contracting COVID-19 while covering stories, what challenges are journalists facing as they report on the pandemic? Joining me now to talk about this is South Africa's National Editors Forum's chairperson, Mahlatse Mahlase. Mahlatse, thank you so much for joining us tonight. Let's just, begin with that very question, because journalists are finding themselves in a very difficult time, much more, like the frontline workers. We are also concerned about our own health as well, while at the same time trying to bring, South Africans the news.
That is true. I mean, we've had to change as newsrooms because the way we are used to doing stories was no longer possible as we're trying to keep our journalists safe. You look at newsrooms themselves, there's no longer press conferences like we're used to. We've had to now adapt to doing Zoom interviews or Skype interviews, but also equally sending out our reporters to certain places. They've had to take care and protect themselves because as much as they are frontline workers, their safety has always been first. So it's been quite a challenge, but I think the industry responded quite well. I think we led in ensuring that, reporters are wearing masks, they're social distancing, using different equipment that we wouldn't use necessarily, just to make sure that journalists are safe. But you're right that the bigger challenge we've faced, obviously, is that COVID-19 has made it quite difficult from a operations point of view, because we've seen newsrooms becoming smaller and smaller. Industry is retrenching. We've seen publications close down. That means journalists are out of jobs. And then we've also seen journalists continuing to work, but also facing salary cuts. I mean, some companies instituted up to 40% salary cuts. So it hasn't been easy for the industry.
And when we then look at, some of the criticism, I spoke to Professor Stephen Friedman earlier, who says that we're not asking the right questions, particularly of scientists. We're not quizzing them enough. We're not probing what they're telling us, and even using that instance of Professor, Glenda Gray there, and that furore that was then caused. And he says that, that particular story stood until the ministry came out to dispel, what was put out in the public space. Are we doing enough in terms of probing, in terms of asking the right questions, as opposed to focusing on the regulations only?
I think the media is really doing and asking the right questions. Are they getting the answers? That's a different debate. I mean, let's look at this particular issue of Professor Glenda Gray versus Zweli Mkhize. How it started actually was one of the news publications reporting that there has been some form of ban against experts, that they're not being allowed to talk, they're being gagged, and it was the media who exposed that. Because journalists were trying to get experts to answer questions, that is how we uncovered that there was some gag on experts, and that was since lifted, and we've been able to speak to experts. Yes, it's a difficult story to tell because the science around COVID-19 is changing quite rapidly, and scientists themselves are learning as they go. I'll give you an example. There was a time in March when we were reporting that you don't need to wear a mask, and actually wearing a mask, you're putting yourself at risk. And then a few weeks later, the scientific world changed and said, no, we've re-looked at the data. Actually, now you have to wear masks. And the media has had to comprehend with that and continue informing South Africans, even though the science is changing. Do we have the right skills in newsrooms? I think not all our newsrooms have specialized health reporters. They've become a luxury over time with less and less people or journalists inside of newsrooms, and that can be a challenge. But I think South Africans have gone to speak to different experts, and not limited to those that the government, those that are advising the government. I mean, with every regulation that the government has come up with, we have found experts outside of the advisory committee to hear what their views are, and their views have been different. All of them have had different opinions, and simply because the science on COVID-19 moves so fast.
And do you agree with, some of the criticism that has been leveled against us as the media, even on Facebook, with some of the viewers saying that because we no longer have beats, of course, taking away, your health reporters, your court reporters, and the ever-changing, world of the media. Does that then make our work shallow? Because, some of the viewers are saying we're not going deep enough because we're always chasing the next big story.
I think all of the newsrooms have different focuses. I think that there are those that are very specifically focused on health stories, and we've seen the depths of having a newsroom that specializes in health stories. I think we have seen that. I also think that we have seen when necessary, when there's confusion in the public and we've had to go to experts and delve deeper, the media has done it. We've also gone to expert also to try and, use language that South Africans understand so that we can explain to them some of these scientific jargon. Has it been easy? Not at all. And in part is because of how quickly the science is moving, but also you look at other platforms where they report in South African languages, translating and finding languages to explain some of these things is also a challenge. This is a new pandemic. We've never dealt with it. So all of it, we are learning as we go. But I think overall we have responded. Should we have specialized reporters? I think that would add to the depth of those stories. But I think when presenters, journalists are doing particular stories, they've done enough and necessary research to be able to give you that in-depth reporting, or at least with some knowledge of what they are talking about.
And looking at the job losses, because, it's been brutal in this particular industry of ours, because we have been seeing, hundreds of our colleagues who are now out of work and not even, able to, get anywhere, because around this time, newsrooms are in fact scaling down. Do you think things will ever go back to normality? Because we were in trouble even before this pandemic.
I'm afraid not. The future is not looking promising, and I think it's a combination of factors. The one is that the shrinking newsrooms, that has been something we've been grappling with for quite a number of years, and COVID just simply worsened that situation. At the moment, when you are operating in a depressed economy like South Africa, and you have a media industry that is heavily reliant on advertising revenue, those companies that are supposed to be coming to the media to buy spaces are finding themselves in difficult times. So whether there will be a boom in advertising again, I really much doubt it, because of the depressed economy that we're finding ourselves in. I was giving an example again the other day of also just people buying newspapers, for example. If people have to choose between buying milk and buying a newspaper, no doubt what actually will they choose. So there are contributing factors, and it doesn't really look good. I think, though, one thing that COVID has shown us is that South Africans are desperate for credible, fact-checked news, and the numbers have shown us, whether it's television, it's radio, or online publications, we have seen a surge in numbers where people are coming to trusted news brands for that credible information. So we are hoping that at least there will be some attempts to invest again in the media, because we have seen there is an appetite for from South Africans and their audiences out there. But I don't think in the immediate future we can see things changing. I think it's quite grim. The job losses might actually continue for quite some time. And I don't think it's just our industry, because we are seeing the South African economy struggling all around.